It takes time to launch a good vaccine. We spent 9 years. Vaccines are the best weapon against disease. We still face challenges in the final stages of eradicating polio. Currently, more than a quarter of the world's nations have insufficient supplies of inactivated polio vaccine. The inactivated polio vaccine is the inevitable solution to global polio eradication.
Vaccines are one of civilization's greatest modern medical achievements. Vaccination has made the greatest contribution to global public health and has shown its past effectiveness. In 1988, the World Health Assembly adopted a resolution for the worldwide eradication of polio. Since 2012, the WHO facilitated the development of an inactivated polio vaccine based on the attenuated polioviruses, 7 strains, and the license out to vendors of all over the world from Netherlands. The WHO also required an annual supply of 20 million doses of SIPV from each vendor after the product was released and marketed. 6 companies were selected for the technology transfer. Polio eradication is not just a national or regional goal, but a global target.
Vaccine production is fairly complex. There are dozens of production processes with more than 150 control points and over 70 critical quality control points that require hundreds of R&D professionals. Hundreds of declaration dossiers are submitted for production application, and thousands of subjects are involved in clinical trials. With all that, our Verocell inactivated Sabin Poliomyelitis Vaccine was finally approved for use on July 12, 2021. Following 9 years of effort. In fulfilling our WHO commitments, we strictly control every step to excellence, from development to production. Development and production would not be enough without a reliable industrial chain. We invited international experts to rigorously audit and design the workshop. We used a bioreactor with microcarrier technology to expand capacity according to the GAP3 biosafety management system. And we had greater accuracy to the controls, ensuring processes and sterility. Preservative and antibiotic-free, we replaced animal-derived porcine trypsin with genetically engineered trypsin. We must be accountable for every step of the way.
The oral polio vaccine can cause cases of vaccine-associated paralytic poliomyelitis and vaccine-derived poliovirus. To eradicate polio, we must eliminate the wild virus and also VAPP and VDPV at the same time. In December 2009, we introduced IPV. At the early stages, our CDC researchers, our vaccine doctors, went door to door to promote the vaccine. That was how we built up a great wall of the immune barrier. In 2000, WHO confirmed that China had achieved its goal to eradicate polio. This is a commitment and contribution to global eradication. Our country has used the polio vaccine since the 1960s. Tens of millions of children have been protected from disease by vaccines. Not only polio, but the prevention and control of all infectious diseases. Our CDC researchers and vaccine doctors are protecting children's health.
Why do we need to eradicate poliomyelitis?
Why do we persist in continually improving vaccine R&D?
Why do we do our best to bring vaccines to children in need?
So far, poliovirus types 2 and 3 have been completely defeated. The global incidence of polio has also been reduced by 99%. However, 99% is no reason to stop. SINOVAC, supply vaccines to eliminate human diseases.